Hello, dear students. Now, I would first of all like to welcome all the new interns. And I know that we are looking at January. In January, many colleges internship is starting. Some colleges the internship will start in February. Some colleges it will start in March. But I would like to take this opportunity to welcome you all to internship. I would like to welcome you to the feeling that you get when you put this stethoscope around your neck and you first time feel like a doctor. You will hear this voice called as Dr. Sahab, please help me. You will, you feel good about yourself. This is about the phase of your life where, things will start changing. In internship, you will evolve from a student to a doctor, from a student to a professional. That evolution will happen and you will feel good about yourself. I'm telling you, but at the same time you will also feel the pressure of what next, what should I do now, what is my next goal. And that is that is nothing new for you. I would like to remind you, this is the same feeling you had in when you were giving the class third exam, that okay, what next, but you knew that there is a class fourth coming up. In the class fourth there was class fifth coming up. There is always something to look up to. Now you have residency to look up to, you have things like specialization to look up to, which branch will I go into, and there are so many things to look up to in internship. So I feel if I have to zero down into one zone in entire MBBS where it makes maximum impact in our future career, would be internship. So I thought I'll make a video on how to approach internship with PG entrance exam in view, and even make a plan accordingly where we do the best of all the worlds. I'll give you an idea and I'll try to talk about in this video all the common questions that an intern would ask. First and foremost, I would like you to know it is possible to do well with internship. Many times children will come and say, sir, how can I do with a busy internship? But if you just scroll back the YouTube channel of Dams Daily, you will see thousands of interviews that we have done over the years with toppers, and you will see a good proportion of them are interns. So the rank 1 AIMS this year is a fresh intern, rank 1 PGI is a fresh intern. So these are people doing internship in busy colleges, and yet they are able to do well. The only reason they are able to do well and some other people are not able to do well is that these people always believed. So the beginning has to be the belief. You have to have this belief that I'll be able to do well with internship itself. Second of my advice is that do not ignore internship also. If you have a college where internship is fairly busy, it's not a bad idea to actually balance both of them. I'll tell you how to balance both of them. But before that, I would introduce to you a term called as mindfulness. So in internship, there will be things that you will be doing which will be more clerical in nature, but there will be things which will be, helping you frame your clinical understanding of things, tiny, small clinical procedures that an intern is supposed to do. I would want you to be mindfully present in that, learn those skills. Now, even if you are putting an IV cannula, it's a good idea to look at what color am I using, why am I using it. You're looking at a Foley's catheter, please look at the paper reel and see what is written on it. It is always good idea to be mindfully there. If as an intern you are mindfully there, you are looking at how a sister, a nurse is reconstituting a drug, what is the concentration, how she's giving a test dose. More you observe how you arrange for blood transfusions, more you observe, more you will learn. And this is also nowadays tested in the exam. Today in every exam there is one or two questions which are a component of how you utilize your internship. So the idea is, if you are going into internship, the idea has to be mindfulness. Now the second question I want to answer here is, a lot of children keep asking me, sir, I am over with my final year, I have a small vacation, and after that my internship will start. How to utilize that vacation time? Now, suppose you have 10-15 days between your final year exams and your internship beginning. My best suggestion is to start off with a volume of DQB. I would always want you to start with DQB 4. especially if you have that vacation period in between. You understand that, most of you, if you have a final year and internship in between, you have 10-15 days gap. You've just done your final year, you're fresh with all these subjects. Why don't you do the DQB 4, DAMS question bank 4, medicine, surgery, obs and gynae, pediatrics, and you know all these subjects, you've just given the prof. This is the time where you can do them at lightning speed because they're fresh in your knowledge, and you can actually be done away with a major chunk of the questions that will come in the exam. In NEET exam, 50% of your questions will be from final year, 50% is from the clinical year, clinical subjects. So why don't, that should, make automatic common sense, that if I have a few days between my final year exam and my internship, I should be utilizing it for DQB volume 4, DAMS question bank volume 4, where the clinical subject questions should be given priority because they are fresh in your mind. I again would like to remind you that it is possible to do with internship. Every year I see people doing it with internship. It is always possible. Actually speaking, doing it with an internship is a blessing in disguise, because you tend to stick only to high yield. Because you have less time, you tend to stick to high yield. More you stick to high yield, more you tend to get, avoid extra resources and unnecessary things, and you tend to do better. I'll explain to you. Now, what happens is, if you don't do well with internship, you suddenly have more time. And you start feeling, if I buy every resource in the market, I'll be better off. And you start adding more and more bulk to your, already existing material. And you end up, complicating the matters. While with internship, that is not possible because you have less time. And that is some way, I believe it is a blessing in disguise, that you don't need to do too much. The exams do not ask unusual things. So you don't need to go for any printed guidebooks kind of material. I'm being very emphatic, very blunt about it, because they have questions from, 10 years, 20 years, 30 years old. And now there's no need to look at anything beyond 3 years nowadays. The exam patterns are more dynamic. So the possibility of doing it with internship is pretty decent. So if you are a fresh intern, you have to have the belief that I'll be able to do it in this year itself. And then we plan accordingly. We utilize the vacation period between the final year and internship by doing DQB volume 4, because we know 50% of the questions in NEETPG will be from the final year domain. That should be my first message. Then second is, you need to introspect. Now you need to introspect about the reasons about your why. You need to look at why, what do I want to look at, what do I want to do in future, what kind of doctor do I want to become, do I want to specialize, do I don't want to specialize, am I looking at my study in India, am I looking at my study abroad. And then you also need to introspect and find what I have done so far, so that we can plan the future. Now, the reason is because if I introspect, I'll be able to make good decisions instead of following, say my friends are doing this, so I'm doing this. This is not a good idea. The idea is always, what have I done before? What do I need to plug those gaps? And how do I make this 1 year count? So if I, discuss with you the entire, phenomena that any people who are doing well in a competitive exam, it has, 3 zones. The zone number 1 is, concept building, understanding, and during that understanding that happens in the classroom, you make notes. And I'm a big fan of notes that you make yourself in the classes, because that has always worked for me. That has always worked for all the toppers. I've talked to 150 odd toppers of central exams this year. They all had attended classes, made notes. Not one of them, I am yet to meet a topper who used, notes written by somebody else. It is, I'm a big fan of your own hand, because I feel you can make magic with your own hand. So sitting in the class making notes is always the first phase. The second phase is revision, where you have these notes and you do them multiple times. And third phase is exam skill, where things like test and discussion, test series, grand tests, they help you to build up the exam skill. Now, if you have to introspect, and I'm telling you, it is possible to do well irrespective of what has happened in the past, provided you are honest to yourself. You need to introspect what phase I have already done. Have I done the groundwork of attending classes, making notes, or am I yet to do that? Once you do this introspection, this will give you an idea on how to plan my future course choices. For example, there will be people who would go for a regular course in internship or post-internship, but these are the people who have already, who are yet to make notes. While TND is a course selected by most people who have done foundation, pre-foundation, and they have already made notes, and so they want to work on exam skill. So TND is a medicine which will work on exam skills and high yield stuff. Regular will build the concepts and the notes, and you need to find where are you placed. And now I want to add a line here. Some of you will say and ask me, sir, I'm a busy intern, so how do I attend classes? And if I miss, what will happen? So that is where, this year 2020, we have built up a DAMS hybrid course. In DAMS hybrid, the regular course program students, they get an access to a video library where there are topic wise videos. If they miss something, there is a video library access, which is a good resource to go to, which will help them to cover up if they miss anything. But there's nothing which replaces the direct live classroom that is happening with you sitting with other students and understanding. That there's nothing that replaces that. But this is a tool to help you if you miss something. Test and discussion course also in 2020 in DAMS would come in a hybrid model, where if after the live discussion has been done, there will be video discussions also uploaded on your app of the same paper, so that if you miss something because of your internship, you should be able to attend. So I believe this would be the big game changer, because this has best of the entire worlds. If you miss something, there is something available for you, but that a priority is attending in the class. When you get up in the morning, get ready, you go to the classroom, there's nothing like it. It helps you tremendously. When you're sitting on your own on a mobile phone looking at video, there's no discipline in it. Why? Do you understand? You can't, suppose you decide to become Sachin Tendulkar, but you decide that, okay, I will play in my own veranda, I'll not go to cricket ground, I'll not meet my coach, I'll not play. See, those things usually don't work at top level. We're looking at top level now. We're looking at competitive levels. At competitive levels, we need to get up, go to a classroom environment where other players, other people are also playing around you. You get an idea on how they are working on, and that competitive spirit will make you do more than what you would do otherwise. Now imagine now if you're reading a book at home versus reading at the reading room. In the reading room, you tend to give in more hours because you have more people around you. That collective energy that you sit in a live classroom, the doubt solving, all that helps you. And you are able to cover more in a day. You are able to make better quality notes. There is no replacement for a live classroom. I'm being very emphatic in it because I love technology. I've been a man of technology, but I know, when a doctor talks to a patient, it has to be a human talking to a patient. Otherwise, everything else has never worked. People have claimed multiple things, but still today, if your relative gets so sick, you go to a doctor, you talk to him personally. Similarly, in a student-teacher relationship, it is the classroom which works. But at DAMS, we value your time, so we have created the hybrid model. Like if you miss something, there are accesses, there are video accesses, there are hundreds and hours of video accesses available to you. And these accesses will be different for a regular program student, and for a TND student, those access will mean those test discussions that you miss. Now you need to plan them. If you have done foundation, pre-foundation before, and if you have made good quality concepts and notes, TND would be the ideal course for you. If you are yet to, if you have not done any classes so far, my suggestion would be go for a regular program, even if you have people telling you something else, because there would be different set of friends telling you different sort of things. But in today's exam scenario, concept building is the key. Concept building is the key. You can't miss out on concept building. If you've not done it so far, you can do it this time. And I have had a girl this time. I don't know if you saw her interview or not. In JIPMER, she had a rank 19 and she had a NEETPG rank of 50,000. From 50,000, she came to 19 only by following regular course program fully and dedicatedly. Now, what do I mean by dedicated follow-up, and what do I expect you to do? Now, let's imagine now, suppose you are in a regular program, then how would you go about things? And if you are in a TND, how should you go about things? Your goal should be attend the regular class. After the class, same day, you have to, it will be difficult in the initial parts, but I have seen children being able to do it. I have seen toppers talk about this. Most topper talk about this strategy. Even if you're in a foundation course, pre-foundation course, you should use this strategy. Regular class, read the notes on the same day to consolidate. Then, and plus please mark them also according to your own needs. Then do questions from DQB. Then coming week, give the class test, analyze your mistakes. Whatever questions you have gotten wrong, go back to the notes. Then start the next subject. This would be your flow more or less in the regular course program. While if you join a test and discussion course, your goal has to be that you will revise your notes and any questions from DQB. You will try to do a mix and match of this before the TND. Then before the TND, when you have done your revision, you give the TND to the best of your ability. Then you also again analyze what questions I have left and what questions I have done wrong. If you have left any question, that means you have no idea about that topic. You need to go back to the notes and see it again. And if you have got getting it wrong, you again need to see why you are getting it wrong, and that will help you. And that in that attending the discussion live would always help you, because when you are attending a discussion, you have that clarity happening, that how teachers are approaching those questions and what other topics will come out of it. The goal of TND will be twofold. Now, one of the goal of TND would be definitely to test your MCQ skills, develop your MCQ skills, give you high yield information. And the next goal of our test and discussion will be to also to give you updates. Like suppose you've done your foundation course or pre-foundation course 2 years back, 3 years back. We already know that when you come in internship, there will be some things that we need to update. So those will be updated in your test and discussion course. So this should be the back of your mind formula when you select a course. If you match yourself to a right course, it is half the battle won, because if you go into a wrong course, you will struggle in the initial part, and time in this entire competition is the essence. How fast you decide, how fast you run would also help you to get better ranks in the exam. Then you also need to plan in between the time, because there will be times where you will feel paucity of time, especially colleges where there are busy internships today. And I am sure you will agree with me that most of the colleges nowadays have busy internship. So you need to create time, you need to manage your time. How to do that is, recently I was interviewing a PGI top ranker. He said that I would always find time during my transit. If I'm in a metro, I'm in a bus, I'm driving, he would find time, and he would utilize during his metro time. He would hear the answers from grand test videos, or he would do the AIMS capsule or the emergency medicine. He would create time on the transit. I'll give you an idea. Like when I was doing my own internship in Maulana Azad Medical College, which is one of the busiest internship that we are doing, and I did it with internship in my time also. So at that time, my strategy was I would utilize the library. Like for example, if my internship starts at 9 a.m., I would be in the library at 7:30 and put 2 hours of study even before my day starts. And then in between, in the lunch hours, in the break hours, I would again go back to the reading room, create time. And between 9 to 5 or 9 to 4, wherever my internship time was, even during that time, I was able to do 3-4 hours, then 4 hours after that, and you could create time. But to do that, you need intent. I always believe time is always about priority. If you make someone is your priority, if you make your career your priority, you would have time. And I have always said this in multiple videos also, that what is the similar thing that you have, what Sachin Tendulkar has, what Mother Teresa had. All great man had similar amount of time like you had. Everybody has 24 hours in a day. It is about how you utilize them, how you create time for your priorities. If you make your career your priority, you will find time and you will be able to do well in the first go itself. But if you let this become an excuse that I am busy, I'm not able to study, then you will push it down, and then it will be difficult to manage time. The managing time, planning your schedules, creating time would be one of the important things that you will do in your internship. Second thing is, many people during the internship, my suggestion is, if you have done a foundation course, pre-foundation course before, you've done your question banks before, then you should also aggressively plan giving grand tests and CBTs during internship. Do not postpone them. Now what happens in internship is, when you are beginning of your internship, the Q banks would always appear more attractive than a grand test. The reason is simple. Q bank, you have only to think about one question, mark the answer, you get the answer. Instant gratification, but that is not the correct thing that will help you in the exam. In the real exam, you have to submit 300 questions, and you don't get the key at all. So you need to think for 300 questions. That 300 question mixed bag thinking, those 3 hours of optimum performance of mind has to be built up. So I would, beginning of the year itself, advise you that please give your grand test with time management. It is very, very important. And you start doing them in March itself. In between dams, last year we conducted 4 CBTs, computer based centers, simulated centers in simulated environment. This year we'll do 5 computer based tests in computer centers itself. And last year 60,000 plus students actually came to the centers and attended the tests, which is a very big number. So I would advise that you add them in your plan schedule at the beginning itself, that this is my landmark where I will see. It is a very good idea to have a chart in front of you in your room where you can plot your grand test performance like this, and see the graph. If it is going up, down, you can plan it. You can put the chart in 2 ways: your ranks, your percentages, or your number of rights, and so that you can get an idea on what is the improvement happening, how many rights you are getting, what is your percentage improving. You can look at all those things, and one more you plan, better you become. And you have to put these resources into your mind that okay, I will have to use my online test series where I have grand tests, I have SWTs would serve as your revision tool. You have DVT coming up in October, you have AIMS capsule by DAMS, you have previous year papers on e-medicos, there are extra resources on emergency medicine infections. So you need to plan all that where will you utilize what. And when you start planning, you start doing it. Now I come back to when I talk about planning, I want you to see the TND. When you will be doing TND, suppose a TND is coming 1 week later and you were supposed to do 100% before the TND, and if you end up doing 80% and you give the TND, then what will happen? I feel even that is good enough. After you give the TND, analyze your mistakes and then start the next subject. It is good to be 80% efficient in all subjects than to be 100% in only 5. You have to become jack of all trades. That smartness, you need to draw lines, because internship you will have less time. In that time, if I'm able to control all subjects, you will win the game. I'm telling you, and you'll rise higher in life. You'll go to the next level, but you need to plan it better. The planning is the key of your success in internship, because the time is less. And I would also like to add here is that whenever we are training or whenever we are doing training, you may not like it. You will not like internship. You may not like the training, the hard work that you're doing, the studies that you're doing. But every minute that you suffer in training will help you in rest of your life as a doctor, as a physician, and you'll emerge out as a champion. Do everything mindfully. If you're in a classroom, be mindful. If you're in internship practicing, be mindful. Find what is happening, why it is happening, why they are giving fluid to this patient, why they are doing this. You will learn, you will evolve as a good doctor. When you enjoy the process of learning, you do better in the exam also. Similarly, when you are in a class, be your best self. Try to be attentive, learn from the teachers, have faith on your teachers, give your GTs religiously, give SWTs in revision. You have to have this plan in mind. More you do this, more you better you become. And in the end, I'll give you the simplest formula of success is. Simplest formula of success is you have to accumulate tiny victories. So I would suggest that from March onwards, when you start giving your grand test or in your TND test or your class test after a regular program, try getting a good rank in those. When you get a good rank in a test, you start feeling more confident. And when you become more confident, you start working harder, because the possibility is that you will do better in this year itself. You start working harder and you hit it hard, you do better. So this is the cycle of successes. First, you accumulate tiny victories, you accumulate confidence, you start working harder, you get a big victory to yourself. That is the cycle. You understand now that if you are confident, you will be working harder. If you're not confident, you will not be working harder. But where will the confidence come from? The confidence has to come from within. It cannot come by, Dr. Sumay telling you that be confident. It has to come from within. And that will come when you win some games. So that is the idea. So that is why if you notice in cricket before the World Cup, you will find the Indian cricket team will try and play county cricket, Ranchi cricket. They will try to play smaller teams, accumulate victories in their bag, start feeling confident that we are on the roll. Then they work harder, then they hit harder. So I feel that should be your strategy in this year. I think I have been, able to give you an idea on how to utilize the time in internship, how to plan it. And I'm telling you, you will feel good as a doctor. You will feel good as a doctor. Internship might be busy, but you will feel good as a doctor. Same holds true for residency as well. When you are a resident doctor, it will be busy, but you start feeling good about yourself. You will start more of value to the society. And if you're value to the society, you feel good about it because you have a purpose. So this is unique of being a physician. As a doctor, we have a unique profession, that our profession is having a large purpose for the society as well. So you have a very, very good satisfaction that you derive from the work that you do. So if you can add to this your academic abilities, your planning abilities, your strategy abilities, exams would happen automatically and you will win easily. I wish you all the best. I would like to welcome you again in this new phase of life. Welcome to the medical profession as an intern. God bless you.